thank you so much, Jacent, for being here with me today. Welcome to my show, and thank you for taking some time to have a conversation with me
Thank
today.
you. I'm excited to chat and, dive into the topic.
Jacent is a mental health therapist, and she is a millennial, and I just love her delivery and her message. And she has a podcast, and she's really utilizing the digital space to kind of bring mental health awareness to us. So I love what you're doing, and I just kind of want you to let us know all the extra things that you're doing that I might not be aware about, and also kind of like the inspiration as to why you decided to take it to the digital space.
Yeah, so I am a licensed marriage and family therapist. And so sometimes I think the title confuses people because they think I don't necessarily see individuals. But the funny thing is that my practice right now is all individuals. So just because the title is licensed marriage and family therapist doesn't mean that I can't see pretty much any constellation. I specialize at this point in working with women of color, particularly, Black women, on things like anxiety, depression, trauma recovery, life transitions, and career stuff. And I also teach undergraduate courses at UNLV, like personal growth, diversity, couples and families, intimate relationships. And then I train the clinicians in the graduate program there, as well as being the on-site mental health professional for a local charter school. So those are like my main gigs that I do. And then on the side, I do contribute on, social media by using the information that I've gone to school for to disseminate to everybody. So to me, I'm like, I went to school for however long. Let me use all of that knowledge to just share with people. That's where the podcast came into play, just wanting a place for the information that I usually share with clients to live, so that it's not just my clients benefiting from that information, but that there's a wider net being cast. Because I think that especially as young millennials, that we are thirsty for knowledge, and we're
Yes.
open to new ideas, and we're just looking for the place that we're going to get that information from. And so I don't feel like I'm the one-stop shop or anything like that, but for anyone that does visit my platforms, I do hope to add value to whoever's stopping by dropping my little nuggets here and there.
And honestly, I know I appreciate it, and I'm sure, you know, your followers and your new to yet to come followers will also appreciate it. And so just really quickly, you mentioned something that I really wanted to just kind of like focus in on. You said you specialize in women of color. And is there a specific reason why you chose to focus on women, and in particular women of color?
The funny thing is that I became a therapist to work with couples. I wanted to do like premarital and enrichment counseling for couples. And
Mhm.
sometimes your niche just kind of finds you. So I was practicing, and I realized that overwhelmingly individual women sought me out for therapy. And I think that there's a couple of reasons for that. I think that individual women of color are, again, some of the thirstiest for knowledge, the most open to learning how to take care of themselves in different ways, learning what's going on and getting in the way of their success in their relationships and in their life in general. And so that's who kind of kept finding me, and I was like, okay, I guess I need to embrace this. And I guess I
Yes.
realized that I was the only Black woman in my cohort when I was in grad school of 30. So it was crazy because there was 3 Black men in my cohort and 1 Black woman. I was like, that's kind of weird.
That was kind of
But
surprising.
right, yeah,
Yeah.
I wouldn't have guessed that, but I was the only Black woman in my cohort. So I was like, if this is what my cohort looks like, it's only 30 of us, but this is a sample of the population, right? Then that means that the ratio of Black female therapists or women of color that are therapists is low in comparison to other people. And so I do recognize that women of color that aren't necessarily Black find me because I'm a minority woman, because they feel like that I resonate with them, if that makes sense. And so I think
Yes.
that's one of the major reasons um, why I've been able to specialize in that way, because there aren't a
Mhm.
lot of people that look like me doing what I'm doing, to be honest, and my age. So there's a lot of like maybe older women of color that are therapists, but not necessarily in this age bracket at this time doing this work. And so um,
Mhm.
I've kind of owned it at this point.
Yes,
and
do it. I love
and I
it.
enjoy it. Yeah, I enjoy it. I really enjoy it because it's like having conversations with what would seem like friends otherwise. But a lot of first generation, a lot of just, women that are killing it in some areas of their lives, but also just need some support.
So this interview is actually a setup for a fake therapy session. No, I'm joking. Can you imagine? But no, it's so true because I know people who are dear to me who have wanted to look for women of color as therapists and Black female therapists, and it's so hard to find one that you like. So it's true. I even tried to help people, and I was like, oh God, there's not a lot of options. So I'm glad that you're doing that work. So with that said, I am an avid supporter of therapy. I think I've never actually gone to any sort of formal therapy, but I see the value and the need for it. And I realize that a lot of areas of health that we don't physically see, we oftentimes don't put enough attention to. I've had a lot of conversations recently with people in terms of their own mental health journey. And I realized that there is a bit of a gap, so to speak, in terms of how we view it. And so this one day I was talking to a friend actually at the time, and it just kind of popped in my head, and I was like, oh, this would be perfect. Or at least I thought the analogy was perfect, but you'll let me know if this is like all wrong. I kind of had the 3 levels of like self-therapy. Then there's like, in a sense, kind of like socialized therapy with your friends and your family. And then your professional level of therapy where you go to a therapist or a psychologist. And I kind of liken that to skincare because it's the same thing. The way I have my own skin routine, but if I notice something is just problematic and I can't get it together on my own, I reach out to my friends. And then if that's not enough for whatever reason, then at that point I would potentially seek out a dermatologist. And so I was just wondering, like, what do you think about that view?
I think you hit the nail on the head. Maybe, I don't know, if you want to come work at the office. No, I'm kidding. But here's the thing. There's people that are taking advice from strangers that are just, like YouTube or podcasts or whatever. Everyone has personal experience. Being able to do your own self-therapy is really helpful. Learning how to self-regulate, emotionally regulate, identify your own triggers, figure out, what's going on and why, I think is really necessary. And the way that I see my job anyway is to help people. I think of myself as like therapy is like a mirror, it's a reflection. So I'm just holding up a mirror for my clients to be able to see and sort through their stuff pretty much on their own. It's just that they need some support. So you hit the nail on the head because it should be a step up process, if that makes sense. If we're taking really good care of ourselves, we won't necessarily have to go and talk to somebody. I always think of physical things or medical things. So I say, we could learn how to be fit by ourselves. We don't need a gym. We don't need a personal trainer. We don't need fitness classes. We know typically, like, to be physically healthy, you eat real food, you move your body around. Very simple, but it's easier in theory than it is in practice. So that's why we have gyms. That's why we have fitness classes. That's why sometimes you have to get a personal trainer or do a challenge so that you can get that support. And that's what I think of therapy as, is there's so much free information out there. The library itself is free. So you can go spend your time reading, you can buy books, you can, buy courses, you can journal. We know what we're supposed to do to be well mentally and emotionally, but that's easier in theory than in practice sometimes. And if you try those things on your own and you hit some roadblocks, then maybe it's time to enlist the support of someone who's trained, who knows how to do this thing, to support you. And that's why I think it's a step up process, just like you mentioned. We go to the doctor annually for physicals. We get our vision checked at least once a year. We find value in seeing a dentist every 6 months when nothing is wrong. We don't go because something is wrong. We do it because we keep this regular wellness routine that helps to prevent for things to go wrong. But unfortunately, because of the history of, the stigma of mental health, that's not the way that we see taking care of our mind and our emotional well-being. And so unfortunately, a lot of people do come in when the stuff hits the fan. So if we were if we were doing if we were using mental health and wellness as a preventative means, we would be able to bypass so many issues, but it's a work in progress. So it's really just at this point about, helping people to slowly open up to the idea of having support, whatever that means. And I always say to clients when they come in, I can give you a whole list of books, a whole plan right now to leave here today and not see me again. And if you do all the things on the list, you'll be better than you were when you came in. But if that's not something that you can do on your own, that's okay. Like we accept support in so many other areas of our lives, but for whatever reason, we don't want to take support in this place, So it's a challenge. It's a challenge, but I love that you're advocating for people to focus on their wellness.
I am, but I love that you said the preventative health side of it. I didn't even think about it like that. That is so true. And it would be interesting to see in the next like 10, 15, 20 years if that is something that eventually is incorporated in preventative health, like insurance policies and coverage, for example. That would be kind of an interesting thing to explore. You actually, like, you said stuff that was so good. I'm like, oh, wait, what was going to be my next question? But so the next thing I do kind of with that kind of self-therapy, for example, what would you say are like maybe the first 3 steps someone could take that is trying to formally create like a self-therapy plan?
I think along the lines of, I want to say awareness, because if you're not aware, then you don't realize that there's something that you need to implement or change, try. So I think that awareness is really, 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 really like a high priority, because that's what's going to be able to help you to see blind spots and what's getting in your way and things like that. So awareness is key, because if you are in denial, you don't think that there's an issue, then of course you're not going to do anything differently. So I would say that's probably the first step. The next step I would say is experimentation. So you have to try things out in order to figure out what's going to be. I say to my clients, like, what your formula is. All of us have a different formula because we're unique. So what works for me may not work for Cindy, may not work for Bob, And so that's why you have to experiment. Even when you go to the doctor, an MD, and they give you medication for something, it's experimentation, because they don't know how it's going to affect your body, how it's going to work within your chemistry individually. And so that's why they say, okay, come back in 2 weeks, come back in a month so we can follow up, right? And so if that in and of itself is experimentation, then we have to kind of take that approach in this realm as well, that you're going to have to try things out. And I think what's discouraging is that sometimes people will try a couple of things out and it won't work right away. And then they'll just say, oh, well, this just doesn't work altogether. And so what I say is that you have to be patient. So maybe that's like the third part of it, is being patient with the process, because you can't work out on January 1st and think you're going to have a 6-pack on January 2nd. And that one workout is going to last you for the 365 days of the year. You have to keep going back. You have to keep trying, new workouts and working out different parts of your body and trying different regimens on different days. And you have to experiment. And so I would say the awareness, the experimentation on what things might be helpful for you, and then patience with the process, because it takes time.
That's so true. And what you just said kind of reminded me, I always think of like us as beings and every aspect of it, where it's like a lifelong commitment to like working on oneself. We're never going to reach perfection. And so we're always a continuous work in progress, no matter what area of life that is in. So
you mentioned this commitment to lifelong progress and evolution. And I think that one of the things that gets in the way is that, for whatever reason, maybe because of society or culture, we say, oh, well, by the time I'm 30, I'm supposed to fill in the blank. By the time I'm 5, I'm supposed to have X amount of kids. By the time, and we put these restrictions and these markers on our lives, and we don't always hit them, because that's life. Life happens. There's a lot of things I was supposed to do this year, but guess what? And so we have to make tentative plans, but be flexible in knowing that it might change up, and it's okay. Like, we're not in a race against anybody else. So that commitment to our own progress and evolution is really important. I love that you mentioned
Yes, I know. I love that you said that because that's part of why I started the channel, and you obviously, kind of the background of it. And it was a bit of a struggle to kind of just come to terms with like, man, things are not going according to the plan that I created. And I am like a serial, like arbitrary deadline implementer and just set these deadlines because it makes me feel like I'm being productive. And kind of like you said, it ends up sometimes kind of being counterintuitive and holding us back actually. So I'm thank you for adding that to it. And I really hope you guys are enjoying this. I don't think I'm going to be able to edit this at all because everything you're saying is like awesome nuggets. So I'll try to keep it moving. So as you guys can see, we're both part of the Scarf Gang. So I'm going to be switching the gear a little bit, gang. And this, of course, obviously anyone can wear a scarf, but we both happen to be of African descent. And so I wanted to switch the question a little bit because I'm Nigerian American and you're Ugandan American. And mental health in the African community. Like, I think, and honestly, mental health in the Black community as a whole.
Right.
So this is going to be kind of a twofold question. Because I think that our community, we're so resilient. We've been through so much that we have learned how to seemingly deal with things by not dealing with it. And we just kind of keep going and keep pushing because that's what I believe it's learned behavior. And we're at a point now that I think our generation, the millennials, are more progressive, and we're kind of seeing that we can kind of not have to deal with it all on our own. And so what would you say, I guess, I don't even want to say 3 steps, just the first step for the kind of the Black community to potentially kind of embrace mental health, and then the sub-layer, the African community, because that one is even more difficult.
Yes. So there are so many layers to it. It's really complex because I was just talking about this with somebody that, when originally, right, when we were all in Africa in our respective countries, there's a high level of structure and rituals and ceremonies and customs around how we do things. And I think that those who are living as close to the original way, I assume, I'm making this assumption, this theory, that they struggle the least, if that makes sense. Because that's how originally we designed our way of life to be. Now, with colonialism, with slavery, with racism and being displaced, so Black American people whose families were displaced, right, and have now generational trauma to deal with. If you were living the original way and you were undisturbed, you didn't have the same issues and factors that came into play. So for Black Americans, there's a whole history as to why people don't want to see professionals because of testing on people. Like, there's real legitimate reason. So it's not,
I was gonna say, we can't trust y'all. Like,
there's legitimate reason as to why there's a hesitation there, because there's trauma there. There's a lack of trust. Absolutely understandable. That's why I'm an advocate for, people at least being able to have a variety of people to choose from in who they see, so that it's not that you only have to choose from these certain people that look like this or come from these particular backgrounds. Not that you have to see a therapist that is Black or Mexican or El Salvadorian or whatever, but that you should have the option. And so I would say, the first step would be taking inventory, if that makes sense. If you look at your life and you objective inventory can say, my life is not being affected by fill in the blank. Any, dysfunctional behavior, communication, trauma, or just, difficult life circumstances. If you can look at your life and say that, okay, you know what I mean? Like, you do keep the self-therapy, you could be doing good. But if your life is disturbed in some way, in your relationships, at work, personally, you're unhappy, and you're unhappy, chronically unhappy, you know what I mean? Not just like today, but like 5 years now, 10 years now, you know what I mean?
Mhm.
Then it might, how can you open yourself up to what might be helpful for you? That may not just be therapy. It could be all kinds of things. And dancing can be therapy. Writing can be
It's
therapy.
true.
Yoga can be therapy. So just the idea of opening yourself up, I think, to what is going to be most helpful for you to grow and
Yeah.
evolve and find peace is kind of where I say that that falls. Now, for specifically those from, African communities, more highly connected, I guess I would say, um,
Mhm.
that is a whole nother story. So
Our people.
they're very set
Yeah.
in certain ways.
Yeah.
I think that at the end of the day, your life is yours. So that's where it comes, because it's individual versus collective. Your life is yours to manage and look after. If you
Mhm.
yourself realize that there is an issue there, and I was just on a call the other day, they said, why wouldn't I go take care of my mental, like I go take care of my body and go to the doctor when something isn't right. So there was a person, I
Mhm.
was on a Zoom call talking about mental health, and they said that they were first generation, trying to explain to their African family, like, there's something that I realize is going on with me that I have yet to figure out how to manage on my own. I need support. And they're like, what? And she's like, trying to explain to them, like, this is me taking care of my mental and emotional body, right? Just like I take care of my physical body by going to the doctor if I have a fever. So it may be more result oriented. If they're completely closed off to the idea or the topic, you might
Mhm.
need to do it on your own, or find outside support from your friends, or maybe there's one family member that you can rely on, or something like that. And then the results hopefully speak for themselves. So when they see that your mood is different, when they see that you are, enjoying family gatherings more, that you
Yeah.
are, thriving at work, I feel like results really speak volumes. So you may have to make a decision and kind of prioritize yourself, get results, and the results will speak for
Mm,
themselves.
and I think that you're right. It is results when people just kind of see your aura change, your
Yeah.
energy change. And whether it's because, like you said, it's self-therapy or other forms or seeking out a little extra help, people will notice it eventually if you're doing it consistent with it. So I love this. I hope we can do this again when my channel has more subscribers. I've been watching you and everything, and I've heard you speak, and I knew that you were gonna like give us all of it in like concise, like awesome nuggets. And I think that this is great. And although it is the end of Mental Health Awareness Month, it doesn't mean it's the end of us being aware of our mental health. And so I just am so glad that you're able to kind of like grace us with your presence. The one last question I do want to ask is, what would be any like parting words that you would kind of share with my audience?
Yeah, the only thing that I would say in closing is to, you know, take that inventory and practice awareness of your life. And I think that when we think of our life going as well as it possibly could, we either get scared or we don't believe that it's possible. And I want to say that it is, but it takes some courage. It might take some support, and allowing yourself to shed, your skin that you've had previously in order to walk into, your new skin and stuff like that. So I know that everyone watching probably has something that they want to do, that they're working on, that haunts them, that they dream about. Whether it's just having better relationships, or being more happy with and confident with yourself, or finding a different job, keep walking toward it. And as you do that and allow yourself to be new and be open, that thing will also walk toward you. So that's all that I would say.
Thank you so much. How can people get connected with you? Because they're going to be like, oh, she's awesome. I want to connect with her. So how can they do that?
So I'm most active on Instagram, and that's Jacent Gems. And then the podcast is the same name, Jacent Gems. Everywhere that you listen to podcasts at, that's where I'm most active. And then all of my links and everything like that are on my Instagram as well.
So thank you so much, Jacent, for blessing us with your gems today. I appreciate it. And that was corny. I'll leave it in. But thank you, thank you, thank you. Everyone, please make sure you like, you comment, you subscribe, and you share. I think this is an amazing and important message, and I think we had some good conversations. So I hope you guys enjoy watching us today. Thank you.